Jaymans to give me such a big opportunity to share my experiences with you, because I'm a medical student. I'm in my 5th year of my medical school, and I'm coming from Istanbul, Turkey. I study in Istanbul University, and I will share my experiences that I have been in the United States. Last summer I was in the United States and working in the medical clinic in the Department of Peripheral Neurosurgery, and we have recently published an article about occult isolated branch cyst of plantar nerve, and actually this is the first known case in the literature. And this is my university from Istanbul, this is my outline. So, what are internal ganglion cysts? They are the mucinous cysts found within the peripheral nerves. The most common site is peroneal nerve, but we can also encounter with them in radial, ulnar, and tibial nerves. And in the literature, according to a systematic review, there is more than 50 cases in the feet and ankle region. Etiology, according to their etiology, they are still speculative for over 2 centuries. There are some processes and theories that we can explain the etiology of internal ganglion cysts, and the most common one is the dynamic mechanical process. In dynamic mechanical process, there is pressure fluxes in the joints that originates from the joint and goes proximally to the parent nerve. And during this transmission, the cyst synovial fluid, the joint fluid, can leak through the capsular defects. Internal ganglion cyst, I'm skipping this, and in anatomy, as we all know, there's tibial nerve, medial calcaneal range, and medial plantar nerve, lateral plantar nerve. Usually, subtalar joint gets innervation from medial plantar nerve, sural nerve, and tibial nerve, but not from the lateral plantar nerve. In the literature, we have seen 2 lateral plantar nerve internal ganglion cysts and 12 of medial plantar nerve ganglion cysts, and which I'm going to talk about. This is our paper that we recently published, this first case of RGC, localized article range. Our case is for a 6-year-old female, and the symptoms were hindfoot pain, stabbing in nature, and street prestige, radiating of plantar foot, and tennis sign was straight positive. And the case report, during the surgery, during a routine tarsal tunnel decompression surgery, we have explored incidentally an articular branch of the plantar nerve, which goes to the subtalar joint, and this is really rare. And we have seen a cystic expansion part of this lateral plantar nerve's articular branch part. And afterwards, we went to the retrospective MRI studies. Further investigations, they're non-specific, but in EMG, large motor unit potentials in the foot muscles, this could have been consistent with either tarsal tunnel syndrome or an early length-dependent neuropathy. And in operation it was under general anesthesia in supine position. We made tarsal tunnel and plantar tunnel decompression, and we cut this articular branch. And after we cut this articular branch, after the operation, in 3rd month and 5th year of follow-up, the symptoms of the patient are totally relieved. And there was some images, but I couldn't show it. So cystic expansion part of the lateral plantar nerve is here, and some other images. So I'm finishing it. According to our previous studies, we further classify these internal ganglion cysts into some phases and stages. 4 phases. Phase 1 ascending to the tibial nerve. Phase 2, it crosses over, and phase 3, it goes down to the medial and lateral plantar nerves. And according to other studies of us, we can also further classify the phase 1 into 4 stages. Stage 0 is just beginning from the joint. Stage 1 is going to the articular branch. Stage 2 goes to the medial or lateral plantar nerves, and stage 3 goes to the parent nerve. The main discussion of us in this case is this cyst an ultimately early component of a cyst who didn't form yet, or a remnant of a previously occurred cyst, which we cannot know clearly. And this is the life cycle of ICGs. So this question is about, is this the auxiliary form of a not performed cyst yet, or a remnant of a previously performed cyst? And in order to diagnose this internal ganglion cyst, we need to use multiplanar and high-resolution 3T techniques. And discussion I talked about. I'm skipping this. Histological examination, there is just 3 things. We see cystole formation, synovial cells, and or fibroblast proliferation, which we cannot see in this case. And this case, the cyst was even below in diameter 1 millimeter. And in conclusion, our department in Mayo Clinic are still working on these cases. And my last words is, I'd like to thank you to Professor Sami, because it was 4 years ago. I was just the first year of my medical career in my medical school. I've been in International Science Institute in Hannover, Germany. He never underestimated me. He always inspired me on going on the way and walking on the way of being a neurosurgeon. And this is my 5th year to interested in neurosurgery. And I'd like to thank you so much, Professor Sami, and thank you all of your organizing committee and Professor. Thank you. Thank you very much.
Thank you. Congratulations for such an excellent presentation. You mentioned this is the first